welcome to another edition of Midnight Mental Talk with Adrian and myself, Leanne. What we're going to talk about today is doctors, psychiatrists, psychologists, therapists in general, and counseling. I wanted to start off, I guess, with a few statistics that I found out about Canada. And I apologize for anybody watching in the States. I did not look yours up. Concerning the stigma that is around mental illness still, I found a Canadian website that actually states just 50% of Canadians would tell friends or coworkers that they have a family member with a mental illness, compared to 72% who would discuss a diagnosis of cancer and 68% who would talk about a family member having diabetes. And there's also 42% of Canadians are unsure whether they would socialize with a friend who has a mental illness. Now that was a big one that I wanted to mention, because that's almost half of Canadians. And the other statistic that I'm reading is the majority of Canadians, 55%, say they would be unlikely to enter a relationship with someone who has a mental illness. The other thing I wanted to mention was almost a third of Canadians who seek mental health care report that their needs are unmet or partially met. The rate is even higher for children and youth. And my last boring statistic for this video is 60% of family physicians rank access to psychiatrists, in Ontario at least, as fair to poor. So I'm not sure about other provinces, but I mean, when you have family physicians admitting that in at least one province, you can probably expect it's the same right across Canada. So I'm going to shut up and let you take over, Adrian.
Not really sure entirely where to start. However, to add to the statistics, really, I actually found out that there are currently roughly 4,770 psychiatrists in all of Canada. So when you sit and take that in and think about how a lot of people's needs have been met or have not been met, or they've been poorly met, and to get some relief of their whatever mental illness they have, it doesn't seem entirely surprising because of the small number of psychiatrists we have. So by the small number of psychiatrists that we have in the country, which means there are a lot more people underneath them waiting for a referral to see them. So their caseload is probably quite large. So that was actually an eye-opener when I found that out, because I didn't realize it was that few.
Mm-hmm.
You know, that's a small number. I guess I probably should have checked to see how many family doctors or physicians there were, or general practitioners, whatever you like to call them. But I didn't actually look that one up. But anyway, what I would like to discuss is the difference between the general practitioner, the psychiatrist, and the psychologist.
Yes, please, do that.
Yeah. The general practitioner is a medical doctor who is trained in basically physical aspect of your health, whereas the psychologist is trained in the scientific study of the human mind, and the psychiatrist is also the same. However, they're a medical practitioner. So the medical practitioner in the psychiatry is usually the common thing is that they are able to prescribe medications for patients. However, there are some places, Indiana was one of them, that has actually allowed psychologists to be able to prescribe medication with basically the discussion with the psychiatrist. So that's a positive term, which also helps. I couldn't find the number of psychologists we have in the country, so there could be a lot more than just psychiatrists. Yeah. The general practitioner usually end up going to the doctor because you have a physical ailment, or you're trying to find, or you have an infection that you need to get a prescription for. It's a general practitioner. It's what you go to the doctor for everyday occurrences.
Mm-hmm.
A lot of people, if you sit down and think about it, a lot of people have gone to a general practitioner because they feel depressed, or they feel sad, or they have a bout of anxiety. So they go off to the general practitioner, not really knowing why they're going there. They just go and tell the doctor that this is what's happening, this is what I'm feeling, and a lot of times those people will come out with a prescription.
Yeah.
That's just as far as it goes. If you're thinking about going to the general practitioner, you should really you should do your research. I'm going to give you a little bit of information here, but do your research before you go. Be prepared with what you're going to go. That should go for any general issue that you're going to your doctor for.
Because your family doctor should actually refer you to a psychologist or psychiatrist, should they not?
Sometimes that is dismissed. They should.
Okay.
But what a general practitioner is supposed to do is rule out any other underlying causes before they give you the referral. Like, I realized something interesting when I started taking thyroid meds that I actually had become happier. Had I gone to my doctor and said, hey, I'm not feeling very happy, I'm sad or depressed all the time, or it seems that way, I might end up a person dead.
Mm-hmm.
But thyroid has an impact on your mood, which I never realized until I started taking my meds.
Okay.
So what a general practitioner has to do, or should be doing, is ruling out all other possibilities before he gives you the referral.
Okay.
However, if he has a sure reason to believe that you have a mental illness, which for some, you're going to notice it right off the bat, that he should be calling and giving you the referral.
Okay.
And usually it is a lot quicker, usually, for kids and teenagers and people who have like severe mental illness such as bipolar, or they were diagnosed with schizophrenia, or they had the symptoms and stuff. It seems like the more extreme, the quicker you're going to get the referral.
Mm-hmm.
Oh, if you're going to the general practitioner, I would strongly suggest taking your information and asking for the referral, because sometimes they may not. But you almost have to demand, hey, look, is there something else wrong with me? Can we do like tests or whatever to find out? Because it's reoccurring. It's been like 3 months that I've continued feeling these things.
It's funny you use the word demand, because you are very right. If you go into a doctor, and I can attest to this, I went several times with complaints, physical complaints, and was ignored.
Yeah. Well, exactly, because you know your body better than anybody else.
Thank you.
Yes.
Yes.
Your doctor's going to be able to poke you, prod you, and be like, okay, yeah, maybe you do have high blood pressure or whatever, but that in order to determine anything, you know your body better than anybody else, so your doctor has to accept that you are coming to them with something that might be strange to you. Like 1 week you're completely normal, flutter in your heart kind of thing, right? Hypothetically speaking. So, you gotta demand these things. After you leave the general practitioner and you get your referral, chances are you're going to go to a psychologist or a therapist before you go to the psychiatrist. The psychiatrist usually is sometimes the last person. If he's not the last person, then he or she's going to be the first person. And then she'll refer you down to a psychologist or somebody that he or she thinks is qualified in helping you.
Mm-hmm.
Yeah, no, that's basically pretty much is what it is. Like if you go general practitioner first, which is completely acceptable, because usually that's where you're going to have to go first, because if you try and call a psychologist, they may just tell you to call your family doctor.
Yeah.
So you get that referral, you go to the psychiatrist, give a little bit of blurb and information about yourself, and then you go from there. Either you go to a psychologist or a therapist or whatever he or she feels fit. And chances are you might have to do a lot of fighting for yourself.
But we are going to cut this a little short. This is going to be a two-parter video. And what can they look forward to in our continuation video next week on the same topic?
Chances are just a little more educational input and probably opinions. Personal opinions and possible personal stories that we've experienced ourselves.
So everyone, please subscribe to our channel, because we want to raise awareness about mental health. Click like if you like the video, and comment below if you'd like to see us do a topic that we haven't discussed yet. And you can also find us on Twitter if you want to talk to us personally, and you can also find our email below, probably.
Thank you for watching.
And tune in next week.
Okay, bye.
Bye.